So we developed 9 priority areas. We looked at testing among vulnerable populations. We were very much interested in a subcommittee that looks at messaging and communications, making sure that we dispel myths as it relates to COVID-19, that we communicate in relatable terms to our community, to the youth, to the elderly, to a large array of ethnic groups, making sure that that message was trustworthy and relatable. We also had subcommittees that looked at vulnerable populations, for example, nursing homes and the prison populations, making sure that those agencies, we're doing what they are meeting the compliance and required to do based on CDC requirements. We also thought it was important to have a policy and regulatory affairs committee that's looking at policies, particularly one that's addressing removing those restrictive barriers to practice for nurse practitioners. We lifted those barriers during the time of the COVID. We're way behind other states. Other states do not have these restrictive barriers. So we thought that this would be an opportune time to make recommendations for that type of legislature. And of course, the community outreach and stakeholder engagement, making sure that we address COVID-19 and those disparities at the grassroots level. And also, we have a subcommittee looking at racial disparities in healthcare as it relates to trusting your healthcare provider, bias as it relates to healthcare providers and how they relate and impact healthcare to vulnerable populations. So that's just a snapshot of our subcommittees. We have the full report and recommendations available at our website, our sus.edu website, that you can see the full recommendations from each subcommittee.